Hello everyone, today I'll be talking about high blood pressure. High blood pressure is a very important topic that needs to be talked about because it's a major problem in the society. What is the cause of blood pressure? Why is it that a lot of people have problem with blood pressure? Well, that's what we're going to talk about right now. We need our heart pumping blood in our body. The heart pressure pumping blood needs to be within a normal range, but when it is too high, it creates a problem. The abnormal blood pressure that you have that is too high is called hypertension. What actually causes our blood pressure to be too high? That is a very good question because knowing it will help us to avoid or control the causes of the high BP. Blood pressure is measured by the systolic over the diastolic. These are two numbers that they use to measure your blood pressure. The top number is the systolic and the bottom number is the diastolic. For instance, if you go to your doctor and the first thing they usually do is to measure your BP, and if you have a BP of, let's say, 120/70, that is a good blood pressure. It only tells you that the top number, 120, is the systolic, and the bottom number, 70, is your diastolic. All right? The systolic, which is the top number, has to be within the range of 90 to 120. If you have your blood pressure systolic within that range, 90 to 120, you have a good systolic BP. And now the bottom number, which is the diastolic, has to be within the range of 60 to 80. If it's higher than this, you will be regarded as having high BP or hypertension. There is also cases of people having low blood pressure, which is called hypotension. But today we're just going to focus on hypertension because that is the most critical problem we have in the society and is more common than hypotension. There is two kinds of high blood pressure problem. The first one is the primary hypertension, also called essential hypertension. All right? This one, in a lot of cases, 95% of cases, when people have high BP, it is the essential hypertension. The essential hypertension are the hypertension that nobody really knows what is causing it. There is nothing that can be pointed out and say is the cause of the hypertension. The secondary high BP cases or non-essential hypertension are hypertension that are caused because of other things happening in your body. It could be from you having kidney problem, or you have a heart problem, or you have diabetes. Those are the ones that are causing you to have the high blood pressure. So this kind of high blood pressure is the one we call the non-essential or secondary high BP. High blood pressure is also called a silent killer. Why is that? This is because many people will have the problem of high blood pressure and they won't even know it. And they think they're fine and they think they are normal. All of a sudden, boom, something happens and then you realize that they've been carrying around a very bad high blood pressure and this will result to their having a major health issues. All right? Let's talk about the causes of high blood pressure. There are a lot of factors that cause people to have blood pressure to be too high. One is your genetic or family history. In this case, there's really nothing you can do about it. It just happens that your family have a history of running a high BP. Your mom or dad or somewhere in the line, your race or your family, everybody ended up having high blood pressure. So if you have a family history of high blood pressure, you have a chance also developing high blood pressure. Okay? This is why sometimes if you look, it happens that the African Americans have propensity of having high blood pressure than other races. Okay? Sometimes you see that men will have more propensity to develop high BP than women. This is just cases that happen, but it doesn't really mean that non-black or non-African American people will not develop high BP. They do, but it just happens that there's more cases of it among African Americans than other races. Okay, so your genetic or family history or your race may also predispose you to developing high blood pressure. Another thing that causes high BP is the kidney disease. If you have kidney disease or your kidney is bad, it will lead you to increased high blood pressure. Overweight. If you're overweight and you're not controlling your weight and your weight doesn't match your height and your age, that is a risk factor for high BP. Not being active. If you're living inactive lifestyle, your sedentary lifestyle, you like to sit on the couch and, not being active, you're putting yourself at risk of having high BP. All right? Excess alcohol and drug abuse. Using too much alcohol, abusing drugs will also lead to you having a very bad high level of blood pressure. Too much salt in your diet. If you're eating and drinking food that has too much salt in it, that is a risk factor for high blood pressure. So watch the amount of salt in your drinks and in your food. Too much stress. If you're always under stress and you're not relaxed, and maybe the work you do, or maybe the kind of lifestyle or the kind of things you do, you're always under stress. Stress level will also lead you to having high blood pressure. Older age. Sometimes people are young, there's nothing, happening to them. Their blood pressure is within normal. And then when they start getting older, at older age, 50, 60, you notice that they all of a sudden start developing high blood pressure. So your age, the older you are, the more chances that you will also develop blood pressure. That's the more reason why you have to do what you can to prevent your blood pressure from going up. Smoking. Smoking is a risk factor for high blood pressure. If you have a thyroid or adrenal disease problem, it will also affect your blood pressure. Sleep apnea. So sleep apnea, people that have sleep apnea will also lead them to having a very increased level of blood pressure. Now, let's go into prevention or treating high blood pressure. Okay. Just like we said, the risk factors of having a blood pressure, those risk factors, if you can control them, then you'll be preventing your BP from being too high. Weight control. If you maintain the appropriate weight that matches your height and your age, you'll be maintaining and preventing you from developing a bad blood pressure. Eating a balanced diet. No excessive calories, sugar, fat. No, you need to eat more fruit and vegetables. Eating more fruit and vegetables is a better way of keeping your diet appropriate and not subjecting you to high BP. You need to cut back on salt. All right? Excess salt. Eating low sodium diet is better than eating food that has too much salt in it. Exercise regularly. Exercising regularly is a good way of preventing developing high BP or getting your blood pressure to be too high. It's really important for you to check and monitor your blood pressure. If it's within the normal range, you're okay. If it's too high, then you need to contact your doctor. All right? Limit alcohol intake. Alcohol intake or abuse of drug, it's not a good idea relating to your blood pressure. If you already have high BP and you're drinking too much alcohol, abusing drug, then you are making it worse for yourself. Quit smoking. People that smoke also have high BP. So quitting smoking is a good way of preventing you from having excessive high blood pressure. Okay. Now, these are things you do to prevent you from having excess blood pressure or developing hypertension. Now, if all these are not working out for you and your blood pressure is still high, that is not good. That is dangerous. Then you need to contact your doctor for treatment. The doctor will evaluate you and then put you on some medications to help control your blood pressure. It's really important to know that blood pressure treatment, hypertension treatment is a lifelong treatment. It's not something you will just take a month or 2 months and then it's all gone. It's never going to go like that. So a lot of people have the wrong idea that if they go to the doctor and they give them medicine and they finish taking the medicine, the blood pressure is low and then it's gone. No, you need to continue to monitor it. You need to continue to visit your doctor. Your doctor needs to renew your blood pressure medicine. If you're on it and your blood pressure is too high, you have to continue to be getting the medicine and controlling your blood pressure. That is how you treat yourself. That is how you have a better level of blood pressure so that you don't run into having a catastrophic illness or having a sudden death. I hope this information will help you. I hope you pass it along to other people because blood pressure is a major issue in the society that's been causing a lot of deaths. So we don't need to have this anymore. The information is out there. I hope I've given you enough information. I'll be glad if you can respond or comment on this video. Good luck.